What Performance Health does is we're a third-party administrator. So we process claims for self-funded employer groups. I always say to people the easiest way to think about us is that we do everything an insurance company does, but we don't take risk. So when you have an insurance company, they're the ultimate risk taker. When you're self-funded, the employer shares a portion of that risk. And what they do is they need somebody to administer the claims and to do the customer service calls and handle all those functions, and that's what we do. Generally we work through broker channels, so a broker would refer us to a client based either on the client need or client size or client desire, but that's what we do. So generally any single company who has employees would, is self-funding is an option. Certainly it's limited by the size, so generally anybody who employs more than 25 people would be a candidate for self-funding. The reason people self-fund is to get control of their health plan. So when you're with a fully insured carrier, you're given a menu of choices, and those are your only options. I have to take one of these choices off that list, inherit my corresponding prices. What happens in those scenarios is the profit. So if your claims are at a certain level, there's a profit, and that profit's retained by the insurance carrier. Conversely, if there's a loss, they take that loss. What most people do is self-funding, and why it works for smaller employers now is reinsurance. They buy a policy that basically hedges their bets, that protects them against catastrophic loss. So as long as those numbers bear some semblance to what their current premium is, they're generally better off to self-fund. They have more information, more access to data, more access to unique programs. What really differentiates an independent TPA from a carrier-owned TPA. So there are Medical Mutual will self-fund an account and administer the claims through a TPA operation. What sets an independent TPA apart is the ability to be more adaptive to the needs of the client, more creative, obviously more nimble. We're able to do things a lot faster than generally the carriers are. Performance Health's been in business for, actually our 5-year anniversary is on 8/31 this year. We've been in Avon Lake for 3.5 of those years. So we made the decision to move back here because space was available. It was certainly a lot less hectic than being over by Crocker Park, which is where we started. A lot less traffic, more accessible for employees. It was easy to recruit too, and we had room to expand into. So those are all the things that we really looked for when we were looking for space.